Here at Epworth Healthcare, and I'm a co-founder of Snowdome Foundation. And Snowdome Foundation's mission is to accelerate new therapies to patients with blood cancers. And as part of that, we are really trying to let people know about COVID and the updates, particularly in relation to patients with blood cancers. And it's been a few weeks since I talked to you last time, and there's been a lot that's changed. So, what has changed when I speak to people compared to what I was saying back in early March? And we've actually got some data. And the main data that I've been reading has come out of the United States and particularly the United Kingdom. And what we've learned, there was two very important studies from the UK which looked at the patients at risk. And the patients that are particularly at risk are patients who are elderly, over the age of 80. There's a very big increase at that age. The risk seems to go up from about 50 to 60 to 70, but it's relatively small and a large step up. Obesity, patients with unrecognized renal or kidney disease, and patients with unrecognized high blood pressure. They seem to be the major comorbidities that put patients at risk of getting a bad episode of COVID-19. So where do blood cancer patients fit in? So there was one study which showed that the risk of blood cancer patients was 4 times above. But in fact, when looked at in more detail and with another study, it showed that the risk was a little bit higher, but only about 1.5 to 2, and it seemed to be predominantly in patients with blood cancers that were diagnosed relatively early. And that was probably includes, and this is one of the things that we'd love to know, but the data's not there, patients that were getting aggressive treatment in hospital, for example, acute leukemia, etc. And so we know that those patients are at risk. So what about the vast majority of other patients who are undergoing treatment for lymphomas, or perhaps have low-grade blood conditions, or have completed their therapy? Well, in fact, the risk is relatively low, and it pales into insignificance almost compared to the major risk factors of obesity, renal disease, high blood pressure. So the risk is there. It's important that we recognise that the immune system may be suppressed. The risk is higher, but it's nowhere near a high risk. So people should not be afraid or too anxious, but should be recognising that social isolation, social distancing is important. It's still very much a public health issue. Last time I spoke about the individual risk, but also the public health risk. And so the government at the moment is still very much focused on a public health issue. You have to see yourself as part of that. And it's not just about your individual risk. And so social isolation and social distancing remains important to stop the spread, because there is going to be a increasing breakouts. Now, whether it's in Bundoora, Bendigo, Beechworth, it's going to be anywhere, and it'll be random. And so one has to really approach everybody in the street as potentially having COVID. And that means social distancing, and we have to stick to that for us all to be safe. The government's policy is suppression. We're not surprised that there's more numbers. That was bound to happen. Ultimately is so those numbers don't convert into people being unwell and people ending up in ICU. If it happens, we're much better prepared. So you need to be prepared with your COVID-19 bushfire plan, which is what I like to call it. Just like we have to have a bushfire plan for your house, what happens if somebody close to you is diagnosed with high risk of being infected? And so I talk to all my patients and say, well, look, what about if you've got kids who are school age and you get a phone call saying that Stephanie's next door, the person she's been sitting with has been diagnosed with COVID within the family. Stephanie's 5 minutes from home. What do you do? Well, the first thing to say is that every person's plan must be different, but ultimately it's very safe. You have to recognise that that you need to have an internal plan about social distancing with your own house, within your own home. What's been really important is that we can now get rapid testing. So Stephanie, for example, would be tested, and if it was negative, great. What happens is that you'll need to organise where is she going to sleep within the house, and how you're going to prepare meals, etc. And then 5 days later, she'll be tested again. Hopefully, she'll be negative. The stress levels go down. So the thrust of this is that each person has to have their own plan. Sometimes it may be for somebody at risk to move somewhere else. Maybe somebody else has got somewhere that they can stay. But the recognition is that you can have social distancing within your own home. And it's a matter of just having meals separately, having potentially, hopefully, if there's different shower areas, sleeping areas, etc. As I said, everybody is different. What about masks? Well, masks work. There's no question that masks work. And so I'm telling all my patients that if they are going into situations where they cannot control social distancing, they should wear a mask. It reduces the spread. It stops people touching their face. People remember social distancing. They move further apart. All of these things contribute to reducing the spread. Secondly, it does seem that the amount of aerosol spray is important in terms of the risk of severity. So masks do reduce that. And I think we're going to find here in Australia that because there is a lot of asymptomatic spread, perhaps illnesses won't be as bad, and therefore patients won't get it as sick. So don't forget, if you haven't got the app, use it, because that will allow contact recognition much more quickly. Certainly all the footballers should be wearing it. Everybody should be carrying their app so that they can connect and find out who's at risk and reduce the breakouts. It's going to last some time. There's no immediate vaccine on the horizon. It's going to take a long time to do testing. We're going to have this wave. Don't rely on the vaccine. One has to recognise that we're in this for the long haul, and we're going to be able to adapt. People are adapting. When the vaccine comes, that will change everything. And a lot of good work is being done in that area, and I'm sure we're going to be blown away with the quality of the science that's going to produce these vaccines. I'm optimistic about the vaccines. It may well be a vaccine that we get once a year. That's what some people are saying. Others are saying that the vaccine may be more permanent. So the key messages really are: have your COVID bushfire plan. We recognise that the risks are relatively low. Please don't panic. That breakouts will be happening. That doesn't mean that the system is broken. Be patient with what happens in terms of reducing suppression. As patients with blood cancers, you can feel comforted. We know a lot more than we did 6 weeks ago, but just have your plan and be prepared, and you'll feel much happier when you go to sleep at night. So hopefully catch up in a few more weeks, and we'll give you some more good news, and we'll keep moving forward together. Thanks very much.